company. But first off, my name's Stephanie Godel. I am the Chief Operating Officer for Century 21 Discovery here in Fullerton, and I am here today with my partner, also my dad, Joe Lynn, CEO of Century 21. Joe, say hello.
How's everybody doing today? Thanks for joining in.
Thank you. I'm also here today with the mayor of our sweet little city, Fullerton, Jennifer Fitzgerald. Welcome, Jennifer.
Hi, nice to be with you.
And then also the CEO of St. Jude Medical Center, Mr. Brian Helleland. Hi, Brian.
Hello, thanks for having me.
Of course. Okay, so let's get going. First of all, most of you know Jennifer, but for those of you that don't, Jennifer is the mayor of our town, and she is incredibly involved in our community from not only time on city council, but what she does for her career as well as her volunteerism. So Jennifer, if you want to kick us off and kind of give us an update on what's going on in the city of Fullerton from your seat.
Sure. It's really my pleasure, Stephanie, to be with you today. Talk about volunteerism. Man, your family there at Century 21 Discovery are some of the best volunteers in town. So I just want to say thank you to you and to Joe and to all of the agents and brokers and staff that make up your team. Thanks for everything that you guys do for our community. There's no way around it. I mean, this is a tough time for our community, for our nation, for our world. And I just can't tell you how proud I am of our community here in Fullerton, and everybody just really stepping up. And all of us have made sacrifices to comply with the governor's stay-at-home order. We've got lots of people. I mean, I am just one family of thousands that are homeschooling their kids, that are trying to hold down a full-time job, and that are trying to still volunteer. I know that's happening everywhere. The city has tried to be really proactive in communicating with people what's expected and what we're doing and how to access city services even now. So I will tell you just real briefly that while City Hall and city facilities are closed to the public, our essential services are still up and running. For the business community and for the for the residents here who are trying to do home improvements and get city permits, our community development department is still open. You can still get permits. Our number of permits that we've issued has gone down slightly, but you can still call to make an appointment. The property inspections are happening using technology like this to do virtual inspections. For our library services, even though our library is closed, you can get a free library card online, and you can download and read many, many books. You can learn a new language. There are library services for you. So if you need a new hobby or need a new book, you can still get a library card. Our Parks and Recreation Department is trying to keep in touch with the senior citizens in town. Meals on Wheels is still operating. OC United and EV Free Fullerton Church have partnered with the city to provide weekly groceries for seniors who can't get out. If you want to participate in that program and be a blessing to a senior, you can sign up at lovefullerton.org. We're working in conjunction with our, so that's just kind of, city services are still open. So if you need something, if you need to know how to access city services now, you should go to our city's website. It's cityoffullerton.com. And you'll see right on the top ribbon is a COVID-19 update. So resources and information you can depend on from the Center for Disease Control and from other health agencies, you can access that through our website. You can also learn how to access city services. So again, that's cityoffullerton.com. And then I would also encourage people, if you are people who don't feel like you can be a blessing to others, you need someone to bless you, you can find resources at 211oc.org. And
Hey, Jennifer,
yeah,
I'm sorry, 211OC, that's to text
it's a website, 211oc.org, or you can call 211.
for if you need any assistance, correct?
Yeah, resources, food, employment resources, all kinds of human resources can be accessed through 211. The governor has partnered with FEMA to institute a Meals for Seniors program that utilizes local restaurants. And in the next couple of days, 211 will be where your seniors can get that information as well.
Okay, thank you.
Yeah.
I just put that in the chat, and then for those of you watching, if you guys have questions, by all means, put them in the chat, leave a comment, and we'll do our best to go through those questions as time goes.
Yeah, and then I'll finish by talking about the biggest question that I'm getting now is when do we get to reopen for business? When do we get back to our lives and get back to work? And I want you to know that I don't know. But the city is working as closely as we can with our county board of supervisors and the Orange County Health Agency to make sure that the mechanisms are in place that will allow us to reopen. At the federal level, at the state level, our leaders have said that we have to have an effective testing program in place and a decrease in the percentage of positive COVID cases over a period of 14 days. So we are watching that very closely. The County of Orange has said that they are instituting 18 testing sites throughout Orange County that will be to test those with symptoms. And we're looking for timelines from the county, just like you are, as to when that testing is going to be up and running. And we're encouraging all businesses to do what the city government's doing. We are making our own plan for how we will assure proper social distancing and enhanced cleaning and the safety of our employees and those we interact with for City Hall and for all our city facilities and services. So I encourage all businesses to start creating their own plans for how they are going to do business once they're open.
So you're saying that it's not up to you or the city council as far as when everything's reopened. You are working with the county, with the state, and all those guidelines kind of come down to the city level, correct?
Yeah, thanks, Stephanie, for asking that. I don't have the authority to reopen all our city services, businesses, amenities. But we are pushing those who have that authority for concrete actions and timelines for when we'll be able to do that. But the most important thing we can all do is be ready for when they finally tell us that we can and that we can start this phased opening, that we are all ready, that we are each ready.
And can we talk a little bit about the parks and trails and how those are, if they're open or not open, and why some decisions have been made to either keep them open or close them? Because people are stuck at home, they want to get fresh air and exercise. So if you could touch on that a little bit.
Yeah, I mean, fresh air and exercise are essential, and our parks and our trails are open, and we ask people who use them to do their part and keep a proper social distance and respect the safety and the social distancing requirements that are out there. We have closed parking lots at many of our parks to discourage big numbers of people from gathering there. But as I have been out on the trail, my anecdotal experience is that the people out there are doing what they need to do to keep themselves and those around them safe. Unfortunately, we did have to close the Pine Forest staircase, and I know that's difficult because it's so widely used. We tried to institute a one-way only on that stair to be able to keep the proper social distance, but everyone's fitness level is different and people are going around the other, and it just got too much. So better safe than sorry is, the philosophy here, and so we had to close that down.
Well, and we participated in the virtual Donate Life, as you probably know. Donate Life was supposed to be this past weekend, but they decided to do it virtually, and we participated in that. And we did 3 miles of 5K on the trails, and there are a lot more people on the trails, which is really cool because that fresh air and exercise is good for the soul. And I was very pleased, just to, like you mentioned, at the amount of people that were still practicing. Like, nobody's being dumb, like,
right, exactly.
Doing their part to keep that distance and exercise smartly. So that's good to hear.
Yeah, absolutely.
And then you guys also instituted last week, I believe, the masks for requirements for going into businesses, correct?
Yes. Yeah. So,
Okay.
so the city council last Tuesday voted to enhance the requirements that the Orange County Healthcare Agency issued with regards to wearing face coverings. And so in Fullerton, as of last Friday, the rule is that when a patron is going into a retail business, you need to wear a face covering. And those employees of those businesses also need to wear face coverings.
There you go. I personally can't stand wearing a face covering, but I understand the importance of it. So, this is not a permanent solution by any means. We're not going to be wearing face masks for the rest of our lives. So it's just, kind of sucking it up and doing it for now for the betterment of our community.
It is. I mean, my husband calls it wearing a belt and suspenders. Usually you just wear one. But in this case, we should double up, right? Just to be sure.
Yeah. Anything else from you, Jennifer, right now before we move on to Brian? And we'll be bouncing back and forth. Okay, because I know you had a town hall earlier. You had a town hall earlier, and you got a ton of questions about St. Jude and the medical side of COVID.
Right.
And so luckily, it just so happened that we have Brian Helleland here. Brian, welcome. You have been part of the St. Jude system. Joe, why don't you introduce Brian?
Brian has been with St. Jude for over 10 years now. He's the chief executive. Before that, he was a chief operating officer. He's got came to St. Jude probably about 15 years ago, Brian.
Yeah, 15.
15 years ago. He came from Eisenhower, and one of the most proficient, knowledgeable hospital administrators in the country, and we're really fortunate to have him here with us. And Brian, take it away. Tell us what you got.
Thanks, Joe. Thanks, Stephanie. Let me start by just first off saying thank you. Thank you to our community. I'll preface all my comments today by saying it's all perspective. We are doing very well, I think, from a St. Jude perspective, from a community perspective. But I think it's important for all of us to remember why we're doing well. And we're doing well because of the compliance, the response of our community, following the physical distancing, the masks. All of those things have been a key part of why I would say we're doing well, comparatively speaking, to other parts of the country or even other parts of California. So we should be proud of that. I know it's frustrating to stay self-isolated and quarantine, whatever term that we're using in every household, but it is a critical part, and we very much thank you from the healthcare community. It's what allowed us as a healthcare provider to not get our systems overwhelmed. and just very, very grateful. In addition, thank you to the support. We've had a couple community parades that have definitely come at great timing throughout this journey. It's really I'm shocked when I think back of how long it's been. It feels like it's been 2 weeks to me. The time has flown by for all the preparation and planning we've been doing. But the thank you to Fullerton Fire, Fullerton PD. We're very humbled anytime our caregivers get to be referred to as heroes by the ultimate heroes in our communities is quite a statement. So take great pride in that. The Rotary Club's been very supportive. Community as a whole. Our last parade of support, we had well over 200 cars and lasted over an hour. And we hear those stories inside the walls of the hospital and all of our other buildings for days. And it's truly very much appreciated and brings a lot of people to tears. I think in the beginning when we were in that first 2 or 3 weeks and still very anxious to what was about to happen to us as a community or us as a hospital, that was really when it just was very, very heartfelt. We did not know what we were about to face. It brought comfort and support at that time, and that was awesome. Let me kind of go back to just kind of where we are. Lots of planning, for several weeks. I think we were on contingency planning overload, like so many other businesses and so many other healthcare organizations. Really got to a place where we were very, very comfortable on the volume and the surge that we were going to possibly get. Also like to, thank our medical staff and our caregivers were, I can't even tell you how phenomenal that they were. We have a unique culture at St. Jude. We're very proud of our culture. We're very proud of our teamwork and our collaboration. And it was from day one a big we. Everything that we did together and got each other more and more comfortable every day. That the plan that we laid out was something that we felt that we could do for. Probably our base planning was at about 140% of our current capacity. So when we looked at beds and equipment and staffing and physician staffing, that's what we targeted. And we broke it down to about 5 to 6 phases of planning. We got to phase 2. So we were very comfortable and even comfortable today that if there's a second surge, we can go well beyond where we even were in the current peak or the peak that we've already experienced.
Hey, Brian.
Yeah.
Are they, I understand this is probably asking you to look a little bit into a crystal ball, but are they expecting a second surge at all?
I think it's reasonable there's going to be another surge. What level that it peaks at, obviously, is the question that's hard to answer. The things that are out there, we had a little small pickup over the weekend, but the things that will be coming, with the executive orders being released, people going back to work, I think it's reasonable to expect that just that level of interaction is going to potentially generate some level of increase. But as you said, it's really hard to speculate. So. We're used to getting different information throughout the country at this point as far as what we're expecting versus what happens. But we're ready for it. We are expecting a little bit, but in a way, we've experienced enough that we can. We took down our tent as an example. We were comfortable taking down the tent. We have a unique facility that has a lot of former beds in it, a lot of extra space. That we can really absorb a lot of volume that maybe a lot of our hospital counterparts really relying more on tents and other types of things. So we're comfortable that we were able to do that. We also wanted to have a symbol to the community that we're ready and prepared and safe. And I think having the tent up kind of just was this additional level of concern that maybe coming to the hospital or the emergency department wasn't safe. We've changed all of our practices and are really moving into what's new. I think the overused term right now is the new normal, but that is a reality, and we're planning just as much about that new normal as we were for the surge. So a lot of our practices are in place. They're going to stay. As we start to open up some elective surgeries or essential surgeries and procedures on the ambulatory side, we're getting those areas ready with appropriate physical distancing in waiting rooms and different types of protocols with universal masking, all those things, testing for patients pre-procedure. So we know all those things. Those things are all ramping up pretty quickly. But at the same time, the inpatient census, the inpatient stress of managing cohorted units. We do cohort our positive patients all on 2 units, a med-surg unit, and then also a critical care step-down unit. So all of our patients are on 2 units. Being able to separate them from the rest of the hospital. We've been referring to the other towers as business as normal and clean units, clean towers. So we've been able to do that and give comfort to our patients and our staff and caregivers and physicians that that's our game plan.
That's a really good update. And I have a random question for you, and I'm going to put you on the spot. I hope you're okay with that. For those of you that don't know, St. Jude, Brian touched on it earlier, but they have such a unique and special culture within those walls, between nurses and staff and doctors and everybody. And they highlight what's called sacred encounters quite frequently. And that's just, goes an over the top encounter with a patient where there's just a really feel good story that comes out of it. Is there anything that's kind of come out, Brian, that you can think of over the last 6 weeks as far as a possible sacred encounter?
Oh, we've got unbelievable sacred encounter stories to continue to tell. They maybe a lot of them are taking shape in a different way. When you talk about not being able to have visitors at the bedside, which is heart-wrenching to watch. We have been allowing end-of-life visitors and other limited visitors, but it's the family being at the bedside and being part of that healing is such a critical part of our belief, but also just in the healing process in general. So a lot of sacred encounters for how we've been able to facilitate Facebook calls or FaceTime calls, other types of live interactions. Our care team has been trying to go above and beyond as many times as possible, set times of the day that we're interacting with families. There's been families out in the parking lot that meet at times and have their loved one go to a window and wave and do things with each other. But the number of sacred encounters, they're just presenting themselves in different ways. And that's what we love about St. Jude, is allowing our family, our team, to be creative on doing whatever it takes to overcompensate for the times that we're going through and making them as memorable as we can and facilitating them. And just giving that empowerment aspect to do that for our caregivers has been great.
That's excellent. And those parades that you mentioned earlier, oh my gosh, anytime I see a video that somebody posts of those, like immediately I start to well up, and it's just the amount of love that's pouring into our community for you guys is just incredible and so special.
It is meaningful. I think, and everybody's going through this in different states, whether it's at home with your family, quarantined, or whether you're in a hospital and you're dealing with new emotions. There's going to be some longer term effects of emotions that I think a lot of our frontline caregivers have been dealing with them on a daily basis. But when there's a little bit more time to breathe and process everything that we've gone through and the level of community support, but yes, those raw moments of support trigger folks that swear that they don't ever cry to actually cry. And so it's definitely been very welcomed and in a great time of need. And we're going to continue to find ways to share those with each other. We've really created resources inside of our organization, inside of our ministry, to have caregivers and physicians be able to have that level of support, that emotional support when they've needed, to be able to step away from a bedside. You were talking earlier about hating to wear the mask, and it's so uncomfortable. I'm with you, and I've got to wear it all day long, but I get to go in my office once in a while and take it off.
Yeah.
I can't imagine what it is to be, some of our staff and caregivers that are wearing it all day long at the bedside. It's hot, it's hard to breathe, it's uncomfortable. We have our own stories of the facial wounds, of our staff that have worn them all day long that you've seen on national posts, and we've tried to keep as much of that stuff inside of our walls as possible, and let that be our family caring for each other, of how we get through it, and just really give our community confidence that we're here for them no matter what it takes. But there's definitely those stories of a little bit of pain and a lot of suffering. But ultimately, there's not a caregiver inside of the hospital that's not focused and rallying on getting every one of our patients to recover. We have had some great success. We've had an above industry success of getting patients off of ventilators, which is an awesome celebration every time that happens. We don't have that many patients in ICU status right now, as we've been continuing to do that. We've done COVID rounds every week, where all of our clinicians that are in the thick of caring for those patients, our intensivists, our hospitalists, infectious disease, pathologists, everybody involved, where they're meeting weekly and talking through every single one of the patients, and what are we learning, what can we do better, how do we transfer one thing to another patient that's working well, and a huge part of our clinical success. But it also just keeps the team together, focused on what we're trying to do. And it's been, from that standpoint, again, all a matter of perspective, but fun and very prideful to watch that level of expertise come together.
Definitely. It's almost like a silver lining that, to find in all of this. We have a question for you, Brian. In regards to if somebody's coming in via the ER with possible COVID symptoms, is there something to kind of triage them or keep them separate from like your normal ER patients?
Yeah, we have a lot of different components to it, but I'll just start with, we are triaging outside the entrance. We obviously had a process in place when we had the tent, and the tent was going to be separating that as well. But if you go into the ER, there's a red zone and a blue zone, and if the screening process identifies a patient as a potential COVID high suspicion, they're going to that red side of the emergency department waiting room, or obviously if they're high suspicion, they're going straight back. And then inside of our ED, our emergency department, we have areas as well that are designated for, they've got negative pressure rooms if there's aerosolizing procedures and different types of procedures that are higher risk. So there's a section of the emergency department that we're having those patients go into, compared to all the other patients that ultimately come back. And that's what our the physical rest of the hospital is laid out that way as well. I talked about our cohorted units already. So the emergency department is kind of a smaller version of what we did in the rest of the house. We put in HEPA filters in rooms to allow for that negative air pressure. We did that throughout the house. We had purchased 100 HEPA filters before, and we were able to really convert some of those environments to the highest safety levels that we could. One of our two cohort units right now have HEPA filters throughout, separate air on one whole floor that's got our sickest patients on it. So all of those different types of practices. And then the other thing on the ED front, we are masking everybody coming in and continuing to work on those ongoing scripting even on the in-house, we're asking to be masked, and don't expect a patient, a non-COVID patient, to be sitting in the room with a mask on all day. But we do want to be able to script our caregivers that say, I'm coming into your room right now. Do you mind putting your mask on, as they're wearing their mask? Just all those things, because just like you all out in the community, the biggest risk is if you run into people who are not wearing masks or following social distancing. Our biggest risk in the hospital is a patient that's not identified, maybe asymptomatic, here for another chief complaint. We want to be able to still make sure that we're protecting our patients, and also very specifically our caregivers, from that asymptomatic patient that may not be identified as a COVID patient.
Definitely. Well, thank you for that. Joe and Jennifer, I'm going to actually unmute both of you. And Joe, do you have any questions you want to throw into the mix right now for either one of you?
I don't have any questions. I'm just wondering if Jennifer's got anything that's come to mind after listening to Brian, and what she's thinking right now, and plus what the dog's name is.
Yeah, I know. Sorry. So I'll start with the dog. That's our new little puppy. She's about 4 months old, and her name's Cookie. And her nickname is really Cookie Monster, because she is a little monster. But she was going to keep barking if I didn't pick her up. So sorry about that. And then she decided, just like a puppy, she decided she wanted something else. But one of the questions that I had for Brian was, what testing procedures for your employees do you have in place, and what advice do you have for organizations for their employees as they come back to work?
Yeah, no, that is a great question. Very timely. Even had a conversation this morning about it with some of our surgeon offices throughout the community. It's as you can imagine. When you talk about testing, there's no one-time testing. So anytime you talk about testing for caregivers, you have to talk about the frequency that you would do it, in for it to have, long-term, positive effect. So as an example, if we tested all of our caregivers in one particular area, how long is that good for? Is that good for 3 weeks? Do we need to retest them in a month? And asking, caregivers or employees, for anybody else, any other employer, to be tested every month. That's a lot of swabbing. Right now, it's definitely not a comfortable test. So, it sounds good from the get-go that we should test everybody and clear everybody, but it's as soon as you really get into operations and processes, it gets impractical pretty quickly. So, really relying on universal masking, personal protective equipment, all the distancing pieces, symptom management. Majority of what we're doing, CDC is an unprecedented time and has obviously had changing recommendations, but they're doing the best they can. So we've really been following all that they've been doing about managing symptoms. How do we make sure that you're managing symptoms? And a lot of those high, moderate, and low level symptoms, most of it is still masking and taking all the caution until you get to a symptomatic point. So we will be testing the patients up front. We have lots of employee checks that we're doing. So we're checking temps and all other symptoms every single day for every caregiver that enters our facility. For the handful of visitors that are coming in, we do the same thing. And then our patients. So all patients coming in are being temperature checked as we've been loosening up and getting some of these procedures that may not be life-threatening, but they need to be done. Our biggest concern is all the backlog of health-related procedures and really, more chronic conditions. We need to get those done. We need to get those diagnosed. The last thing that we want to see is delayed identification of diseases. So our focus is our patients and making sure that they're getting identified for treatments that they need to get. You've heard nationally what's going on. People are delaying strokes and cardiac heart symptoms and not coming to emergency department because they're afraid. We want to make sure that we get to a comfort level that people are not impacting their own health because they're afraid of COVID. So the testing of caregivers is difficult. I think certain smaller employers, especially if they're just coming back the first time, maybe testing up front. Our testing sites that we're opening up with our health system, they're called Providence Express Care. There's going to be one down the street in Harbor. It exists, but there still needs to be a physician order to have that testing done. Our testing that we're doing, we're not functioning as a testing site, but we are testing appropriately when there's symptoms, obviously when patients are presenting to the emergency department. But our caregivers, what we're testing is, when they're symptomatic, making sure we've been very, very conservative. My approach, my plan all along was to stay as conservative as possible. And if we had any exposures, we're keeping those employees out as long as possible, as long as we had staff to take care of the patients that we had. And we were able to really stay as conservative as possible. Other parts of our country obviously have not been able to do that. I know a little bit of long answer on the caregiver testing, but I would focus on the upfront, getting people comfortable and coming back, but having to be practical moving forward about how long clearing a caregiver or an employee for testing is really only going to be good for those 2, 3, 4 weeks, and then you're going to have to test them again.
Well, I'm glad you brought up, Brian, hopefully not withholding, if you do have like strokes or heart attacks, not staying home because you're scared, and the importance of what you guys are doing to make sure patients are being taken care of. And, it is detrimental to push that stuff aside, and you guys are able to handle both at the same time.
Yeah, especially now. I mean, at the beginning when, and I tried to say this earlier, but it's important that we all remember we're in about the best case scenario we could have been.
Yeah.
We as St. Jude, we as our community, we as our country, we're expecting this to be far worse than it was. And not to say, knock on wood, there still can't be surges coming up, but we're in best case scenario. To be where we are, to flatten the curve as soon as we did, and particularly Orange County, we just have to have that perspective and that frame of reference. Now, moving forward with that is, how do we still, limit the exposure, limit the fears, limit, another spike? We've got to do all these other things. But inside of all of that, however long this was going to last, 2 months, 3 months, 6 months, a year, we have patients who need healthcare. Mm-hmm. I don't want to, we have early detection mammography equipment for a reason. We want to detect those as early as possible. And those are elective screens that right now, and they can be deferred, but you don't want to defer them very long because you still want to be in that early detection point. So, and that falls in for all diagnostics, even orthopedic and ongoing functional impact of postponing orthopedic surgeries. That's a concern for us. We want people to not have long-term lingering effects because they didn't have surgery for 3 months, 4 months, 6 months. And again, you can use that almost in every subspecialty, but it is very important, and we're trying to not take our eye off everything we need to do from a COVID and a spread perspective, but we absolutely owe it to all of our patients in this community to make sure that we're keeping people, healthy for all their other conditions.
100%. Thank you. A question came in for both of you. Brian, I'm going to give you a chance to take a breath. So Jennifer, one of the questions that came in, is there anything our community can do to address a need that we might be able to assist as community members?
Yeah, I mean, there are a ton of needs all around you. It's a great question. I appreciate, the heart behind the questioner there. I would encourage you, I mean, obviously you can, there are some sites that you can go to figure out how to help, like Pathways of Hope or OC United. You can go to lovefullerton.org to sign up to be a volunteer. The Red Cross is in desperate need of blood donations. And so you can call the local Red Cross and donate blood. I would really encourage you to look next door if you haven't already, identify, who are the vulnerable among your neighbors. I know I just thank God for the neighbors that we have who have been texting each other to check in and leaving little notes on people's front porches, and really just trying to be kind. We're all kind of starved for human interaction, right? So anytime one of us see the other like walking our dogs, we like jump out of the door and go, "Hey!" I mean, just look next door to you, and see what's out there. And there is, if you want to be a blessing, there sure is someone who needs to be blessed right by you. But also, again, for those who need serious resources, you can go to the city's website and be directed to 211 OC. And again, you can call 211 on your phone if you need resources, or 211oc.org.
Good. And I put that in the comments earlier
Yeah.
too. So that's such a great resource. Thank you. And you're so right in regards to the craving of human contact. And one of my dear friends was saying yesterday, we need to stop using the word social distancing and use physical distancing, because stuff like Zoom happy hours or, properly distanced chats while you're walking
Right.
your dog, all of that is good. And
Yeah.
we as humans need that,
Yes.
So
Yes.
thank
Yeah.
you.
I'll say, I definitely agree with the physical distancing versus social distancing. We've tried to switch our language to that, several weeks ago, and it does help. Talk about it more as a serious, practical matter than sometimes it gets lost when you talk about the social distancing piece of it. Our community support has been, so tremendous. I can't even, think of asking for anything more from our community. I think the thing to stay focused on is still compliance with wearing a mask and the physical distancing. I know it's easy sometimes to fall into there's parts of it that feel overblown. I think it's important for people to realize we created that by our compliance. We created our success by how we as a community and a broader community were able to curb what happened in other places. So don't forget that part. I think it's going to be easy to try to go back to normal. We're not ready to go all the way back to normal, and that's probably the biggest thing, is for people to believe that and not get caught up in all the other things that are being talked about throughout the country. Even though that pain and suffering is going to be just as painful when you start talking about financial recovery throughout our country in every industry. So other ways we try to remind people to support local businesses, and whether that's restaurants and ordering out as much as possible and doing all those things to help all of our other fellow businesses do what they can and make do during this period of time. There's so many best practices that are coming from this period of time, whether it's just appreciating each other and appreciating people, but there's a lot of practices that are going to stick and that aren't going away.
Agreed.
Whether that's technology, whether that's how we care for each other, how we interact or stay safe, or hygiene, or whatever it may be, that's there. But from a hospital needing anything, we do keep getting asked about donations and support. We are good from a PPE, that personal protective equipment perspective. There was definitely times at the beginning that felt touch and go, where running through the hospital at midnight, waiting for a courier to bring something. That's just the name of the game, that what we were trying to do, but we were absolutely committed to getting our caregivers anything that they needed to feel safe and comfortable. And if there was ever a moment that they didn't, then they needed to call the command center or find a leader, and we'll talk it through, and we'll find a way to make sure they feel safe. But on that front side of, I know was very, very hard for people to think of a hospital our size, running out of Clorox wipes or masks or anything like that. But it was just what happened to toilet paper and paper towels. It did the same thing to the medical supply industry, and our supply chain was pretty backed up and messed up for a period of time, and that's just something that we all had to learn and manage with. But we found ways, and just a stat that I'll give you kind of during that period of time. In a 6 weeks period of time, we used 1 year's worth of personal protective equipment in 6 weeks.
Holy smokes.
Just to try to, for those folks that are thinking about it from a true utilization rate, that's what we experienced.
Wow. That's way more than I thought. And I do want to know what everybody's doing with all the toilet paper they now have. But in closing, just one more question for both of you guys. And Brian, I'll start with you. And then if there's anything else you'd like to add. Clearly, communication has changed in every industry. I mean, Joe and I are communicating with our agents on a totally different level, Zoom calls daily, all this stuff. What is the best, and what's the best way for people to get the most up-to-date information in regards to what's going on with St. Jude?
Lots of different, forums. We definitely been using our Facebook sites. We've got the hospital site. We also have the Memorial Foundation site of doing it from both. I do have a community newsletter that I send out that goes out to a decent amount of community leaders. More than happy to add people to that that may be listening and want to hear those things from that perspective. Those are the main outward. We've been trying to not repeat or overwhelm. I think there were so many different sites out there, from CDC to state. Our health system had a site from Providence. Providence has got some great, broader communication that we didn't want to be redundant with a lot of that. Mm-hmm. When we were in our crisis, we definitely wanted to have our communication resources focused on our internal communication and internal to our team and our physicians and our caregivers, so that we were all on the same page. That's what we really felt that we could. Our community needed us to focus on that as job one, and we'll probably add a few other post this communication vehicles from our communications team. But I would say our Facebook is probably the best. And then the website itself it's a little bit more static, obviously, but we do respond to those questions very timely. So any means to email specific questions, if they are administrative in nature or escalated to me, Duran, our communications exec, gets those to me timely, and we respond to those. So lots of different vehicles. The part for us that was, the communication inside the walls, what ended up being special for us. We tried to be very creative, tried to be real time, used a lot of LCD messaging, had a lot of daily communications. We were communicating our numbers on a regular basis, our status of PPE. We were very present. We tried to be 24/7. Our leaders, I think, were absolutely unbelievable in showing their love and support for the caregivers. And we had people, in harm's way every day, right in front of going into patient rooms. And I'll share a quick, story. But and we as leaders we needed to be there. We couldn't ask our caregivers to do anything different than we weren't willing to do. But one of the things that we ended up seeing as best practice was proning, for our ventilated patients or all COVID patients. And that's just flipping our patients every 12 hours and on their stomach when they're on a ventilator, and allowing that oxygenation through the lungs to improve and move and get to the healthy, good part of the lungs. But that process, to do that, it took 8 caregivers to go all full PPE every 12 hours to go into a patient's room and do that. where there's a lot of organizations throughout the country. We're absolutely minimizing the number of patients going into positive rooms. We took a different approach. Our caregivers appreciated, understood it. We're willing to put our patients number one, and if that meant we needed to have 8 people go into the room and flip patients because it was the best for their recovery, that's what they did. And then after that, every 2 hours we flip them. You think of a swimmer's stroke, kind of a left and then a right. So every 2 hours we switch them with one arm up and one arm down in that swimmer's pose every 2 hours, and that took 4 personnel. Every time that happened, putting themselves in the room, and that was all our caregivers. We absolutely love our physicians and our nurses, and they do amazing things. But the one message that, from a hospital administrator perspective, is don't ever forget we've got a ton of caregivers in our organization, whether that's our respiratory therapists, our transporters who are in there flipping patients, our EVS staff. There is so many therapists, technicians, so many personnel that are right in there with our doctors and nurses. It's just so critical for people to know that everybody in there was really participating in the same way. That communication part of all that is where I went off from, Stephanie. Where the communication inside of our walls of everything that we were doing and that we were in this together. Our team saw the critique that was going on in healthcare throughout the country. Even locally in our market, they saw the fights and the pointing of the fingers, in other organizations, and there was no way in hell we were going to let that happen at St. Jude. And that was really because of our caregivers' commitment to that, just as much as our leadership commitment to that. We're one family, one team, and we definitely were going through this together.
Well, and I think you said it perfectly. You guys are extremely present, and not only that, you're extremely transparent. And I think when you are those two things, it kind of closes that door for any questions or doubt. So I commend you guys, and I commend you as leading your team to that great success. And like Brian said, I think the best opportunity for updates is definitely through their Facebook page. If you need a good cry, you can go watch the videos of their parades. But it's really incredible to see that support. So Jennifer, what about you? Where's the best place for the residents of Fullerton to get their updates from?
Yeah, thanks very much. And Stephanie and Joe, thanks again for having me. I appreciate the ability to get the information out. And it's great for me too to hear from Brian at St. Jude. We are so fortunate to have such a fantastic resource like St. Jude here in our community. Again, it's our Facebook page, our Instagram page, City of Fullerton or Fullerton, California. You can look it up on Instagram and Facebook. You can sign up you can subscribe to our COVID alerts. Again, by going to our website at cityofFullerton.com/subscribe. And so you can see what alerts, what the latest news is. And then, one of your listeners on the side here, Patricia, brought up a good point about people who are not senior citizens, but are isolated and need assistance. And I would encourage, again, that's why I said, figure out who your neighbors are, right? It's a little more complicated now. You just can't knock on their door and introduce yourself, but figure out who your neighbors are and who needs help. And then also, we have, if you can't get your questions answered by going to our website or looking at the updates, you can call City Hall and a member of our management staff will answer. And that phone number is 714-738-6300. So again, that's 714-738-6300. And again, I know this is incredibly tough for everyone, and that's an understatement. But like Brian said, I mean, we are doing this well because so many of us have complied with this stay-at-home order. And I just want everybody to know that your city leadership is working really hard to understand the criteria for phased reopening and trying to understand how to be ready for it.
And I think, Jennifer, it being almost 6 weeks into this, or 6 weeks in, I know people are antsy. People just want to get out there, but to continue to follow the orders and also understand that it does change constantly and it is a lot to digest. I think a lot of bit of grace needs to be given in times like this. And everybody's doing the very best they can, whether it be you from a city level, your team over there, Brian, your team at the hospital. It's just things are constantly changing. So thank you both. And Joe,
Hey,
you've been
Stephanie,
awfully quiet. How about you wrap us up?
Hey, Stephanie, can I just make a comment before Joe wraps us up? And Joe maybe was going to say, I just don't want us to lose sight of, we have had patients that have succumbed to this virus and lost their lives, and family members that were impacted. We've also had caregivers that have been exposed and have had to deal with their own recoveries. And talking through our successes and kind of moving on, I just don't want to lose sight of that, and want those families to know, we're thinking of them, and we have patients in house that are still, fighting for their life with this disease and with this virus, and that's still front and center, and by no means want anybody to think that that's not who we're thinking of.
I'm so happy you brought that up, Brian. Thank you. It is obviously still very serious, and for those of you that have lost anybody or have family members currently battling this, you're in our prayers and our thoughts, and that's definitely not to be forgotten. Thank you, Brian. Joe.
There's a saying out there: when preparation meets opportunity, success happens. And I am completely blown away by the preparation that our city has put together to fight something like this. And Brian, the hospital is amazingly prepared for this as well. And it's interesting. I heard somebody say, we are in an all-out war right now, to whereas the enemy has no religious connection, no race connection, nothing of that sort, no political agenda, no other. The only agenda it is to attack. And the hospital, Brian, has done an amazing job of staying on the forefront of that, and we appreciate that. Your preparation was crazy, not just out of the box thinking, and you did an amazing job with your team. Jennifer, to watch how the city has reacted, to watch how our fantastic police department, our fantastic fire department, the city services have come together, the challenges that the city has had to be able to make that happen, it's just really admired by a ton of folks out there, and we're really appreciative. And at Century 21 Discovery, we're really appreciative that you both took the time to join us today to be able to spread the news. We just felt like it was really something that the community was thirsting for. And you two leaders, thank you very much. And Stephanie, great job. We appreciate that.
Thank you.
I need one more big thank you. I forgot Ken Domer and Hugo. Now that you were thanking the city, they were phenomenal, unbelievably phenomenal on the resources that were offered up on our campus with the tennis center, all the way down to the YMCA offering the Y. The city was unbelievable in the willingness to help in absolutely whatever way possible with really regular check-in. So, Ken, Hugo, I apologize for saying this at the last minute, but thank you guys so much.
That's awesome.
All righty, you guys, thank you so much for being with us today. I hope everybody watching, you are staying safe and healthy. Stay tuned for more updates. I'm hoping we can do something like this again in the next week or so. But with that, I hope you guys have a great day and a great week, and we'll talk to you later. Bye.
Thanks.
Bye.
Bye.